Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 6 starts now.
As Michigan loses more people to coronavirus, at least one local hospital is poised to reduce the number of nurses on staff. Thanks for being with us for the news at 6. Important to mention here right off the top, just within the past couple of hours, the state of Michigan has expanded the criteria for testing for COVID-19.
That's right. That criteria now includes people with mild symptoms of fever, coughing, or shortness of breath. We've posted the full details of this change. You'll find them at clickondetroit.com. Now, Michigan's total number of COVID-19 cases now just above 27,000. with 1,366 newly confirmed. Another 166 patients have died, pushing that total to 1,768. General Motors says the first batch of ventilators it's been mass producing with Ventec are ready for delivery. They began mass production today at the GM plant in Kokomo, Indiana.
CEO Mary Barra was on hand to oversee the operations. GM says more than 600 ventilators will be shipped this month, with the full order of 30,000 to be completed by August.
The press in Washington right now assembled and waiting for the daily news conference from President Trump and the coronavirus task force. A live picture here from the White House if you want to watch it live today, occurring from the Rose Garden. We're going to stream it for you at clickondetroit.com. And Lester Holt, the NBC Nightly News team, will have the latest from the White House ahead here on NBC Nightly News at 6:30.
Well, it sounds strange to say it, but at one local hospital, the number of nurses on staff may soon be reduced. Local 4 Business Editor Rod Maloney is live tonight at McLaren-Macomb Hospital, where they're looking at furloughing a number of nurses. Rod, what gives here?
Yeah, Kim, you know, staffing at a hospital has been a really difficult issue. They've had mad scrambles to try and have enough nurses in varying areas of the hospital. But then there are other sections of the hospital where they're not doing much, like in surgery. And so therefore, there are going to be some nurses here who are going to get sent home for a couple of weeks without pay. The hospital makes no bones about it in a statement, quote, "As we eliminate non-essential procedures in line with the governor's order and CDC recommendations, surgical patient volumes have been greatly reduced. In response, we have offered our surgical services nursing team the opportunity to take voluntary temporary furloughs, which allows them to preserve their paid vacation time and apply for unemployment." The hospital started talking with the nurses union a week ago about this, but Union Local 140 President Jeff Morosky says the hospital has not done a good job with this.
They should have been able to do the whole thing at the same time, but I think they thought they would. They were going to need more nurses in each department than what they actually need now.
His point is a lot of nurses ended up shuffled around the hospital to work largely with COVID. And then when it was time to allow for furloughs, the wrong nurses got the offer. What's more, Morosky's been busy collecting some 1,200 signatures from nurses and local community members and leaders, and he intends to deliver that petition on Thursday, demanding the hospital step up its staff support with PPE, paid leave, and hazard pay for nurses.
They're very scared. A lot of them are working a lot of hours. We're getting more and more that are testing positive, that are sick, that are having to stay home.
Well, the hospital isn't commenting on the petition, but they are saying tonight that between 10 and 20 nurses will get those furloughs. The union says that they're still trying to figure out how all of this is going to work, but in the end, the hospital is saying they're going to last on this furlough until May 2nd. Reporting live in Mount Clemens, Rod Maloney, Local 4.
All right. Thanks, Rod.
We had a chance today to speak with Senator Gary Peters, who's on the committee that oversees FEMA, and he says help is on the way for frontline healthcare workers who need personal protection equipment.
What FEMA has set up is an air bridge. They're now going to places like China and other places that make personal protection equipment. We're sending airplanes to those countries, loading them up with personal protection equipment and getting them back to the United States as quickly as possible. But that has to continue. It has to ramp up even more. But I also say that certainly help is on the way. We're seeing Michigan manufacturers starting to turn out more personal protection equipment here in Michigan. And over the next few weeks, you're going to see increasing quantities of that coming forward.
We hope you'll join us Thursday night as Senator Peters and Senator Debbie Stabenow answer questions on the coronavirus pandemic, a live town hall made possible by a partnership between the Detroit TV stations. I'll be joined by Huel Perkins and Carolyn Clifford for our second town hall event, which will be broadcast across the state. You can submit your questions for the senators at clickondetroit.com. Senators Town Hall live Thursday night, 7 p.m. on Local 4, and we'll stream it on Click on Detroit.
Oakland County is taking additional measures to address the coronavirus. The county opening its own drive-through testing center. Testing will be at the county office in Pontiac and is only open to essential workers, Pontiac residents, and those at higher risk for coronavirus.
Also, an executive order now requires essential workers who come in close contact with the public to wear a face covering. County Executive Dave Coulter said this could be the norm for a while.
For all of those of you who have been wearing these, you know that, after an hour or so, you sort of just get used to it and it becomes the way of life. And I think this is going to be our way of life for a little while. And so we just all need to get used to wearing these, and especially in our essential businesses that are interacting with the public. Like I said, our employees, when they come back to Oakland County and they're interacting with the public, they'll be wearing these as well. We know these are the recommendations of the CDC, and so we all just need to start to get used to wearing these.
Now to a question that has popped up from the start and is still asked. If the seasonal flu kills tens of thousands of people every year and we don't shut down the economy, why are we closing everything for coronavirus?
Yeah, it's a question that seems especially relevant as politicians debate when and how to reopen businesses. Our Dr. Frank McGeorge is here to help explain the differences. Doc.
Yeah, guys, one of the biggest differences that we've seen is how the viruses strike a community. Flu season lasts for several months each year. COVID-19 cases, well, they've been hitting in a much more concentrated way. For example, COVID-19 recently killed as many New Yorkers in 3 days' time as the seasonal flu typically does in an entire year.
Make no mistake, seasonal influenza is deadly too. The CDC estimates up to 56 million Americans have had the seasonal flu from last October through the beginning of April. Between 24,000 to 62,000 Americans have died from it. By comparison, COVID-19 cases are now approaching 600,000, with more than 25,000 deaths. With limited testing, we have no idea how many Americans have actually been infected by the coronavirus. But remember, to help limit the impact of the seasonal flu, we have an annual vaccine and treatments too. Some people also have some degree of natural immunity from previous exposure to similar strains. There is no vaccine for the coronavirus, no proven treatment, and no one has any natural immunity because it's a new virus. Without the social distancing and shutdowns we are currently experiencing, the coronavirus would spread through communities much more rapidly than the flu, overloading the medical system. COVID-19 patients also tend to be sicker for longer. The median length of hospitalization for an adult with the flu is just under 3 days. In Seattle, for COVID-19 patients, the median stay was 12 to 17 days, most of those in the ICU.
Now, another major difference is the level of PPE required. When I treat a flu patient, I don't need an N95 mask or an entire face shield. With COVID-19 patients, healthcare workers need this protection to reduce our risk of infection.
Yeah. Well, Doug, we haven't heard much about flu cases as coronavirus cases have ramped up. Is that because flu season is over, or are doctors just not testing as much?
Well, it's a little bit of both, actually. Flu season is winding down, but most of us aren't sending flu swabs anymore because if the person turns out to have COVID and not the flu, just doing the swab actually exposes us to more risk. So practically speaking, if we really think someone has the flu and they're still in that window to get Tamiflu, most of us would just prescribe it and not expose ourselves to the extra risk of doing that flu swab.
Sure. Okay. Doc, we appreciate it. Well, golfing during this stay-at-home order has been a very hot topic. The governor has ruled golf courses are not essential and should be closed right now.
But the Local 4 defenders keep getting tips about people who are using golf courses, and there is a lot of misinformation about whether it's okay to be on a golf course. Karen Drew, defender, went to the governor's office and the attorney general's office for answers.
Governor Whitmer's office says its executive order is clear. Golf courses cannot be open. Doesn't matter if it's public or private. But we did discover there is a loophole, and many police agencies I've talked to tell me off the record they're not enforcing this order.
The weather is warming, the grass turning green. It's that time of year people want to hit the golf course. In fact, Local 4 Defender cameras captured people doing just that last week over in Commerce Township as well as Royal Oak. Under the governor's order, golf courses cannot legally open.
You know, it's not critical infrastructure. It's just not. They are not necessary to sustain life. And to be candid, just by engaging in it can expose people to risk, serious risk.
Her executive order states golf courses may designate workers whose in-person presence is strictly necessary to conduct minimum basic operations. That does not include serving the public. So, courses can't collect fees, can't arrange for golf carts, but if the owner of the property gives consent to golf, well, it seems that is allowed as long as they keep their social distance.
We are not ticketing or arresting people because, again, as you know, clearly there's so much confusion what they can and can't do. I'm not going to be in the position to add more anxiety and hand them a ticket when it's difficult for most people to understand what the rules are in some of these situations.
The Attorney General's office told me if a closed golf club does allow people to golf and the golfers don't keep their social distance, then the responsibility falls on the club.
Our call volumes are up between 12 and 15%. I'm not going to send somebody out on foot away from their patrol car, because you can't drive a car out on the golf course, looking for individual golfer or golfers, as long as they're keeping social distance. According to the Attorney General last week, that was permissible.
The AG's office tells me the photos they have seen of golfers shows they are not keeping their distance. So that lands on the hands of local police. And that's the issue. Confusion over the order and police not having the resources and time to be tracking down golfers. I'm Karen Drew, Local 4 Defenders.
All right, Karen. Well, I don't think I would have been out on the golf course today with a day like today. It was pretty brisk out there.
You would have needed a heavy parka, I think, in some cases, maybe some gloves. Wind chills right around freezing. There was some sunshine, but believe it or not, we could have snowflakes tonight. We'll look at that for Live Radar next.
Have you tried calling the state's unemployment hotline today?
Welcome to the state of Michigan Unemployment Insurance Agency. We are experiencing heavy call volumes.
What does that mean? And what changes are being made right now to help make the process easier for you? I'll take a look at this issue tonight in my Help Me Hank report.